That's so wonderful. I'm sure many women must be thanking you right now to understand that it's not at all difficult and one can be treated for it. And they should go and get themselves checked. Hello, friends, and greetings from VLCC, and a very good evening to all of you. I'm Dr. Anju Ghei, Vice President and Head Preventive Healthcare at VLCC, your host for the session today. And with me are co-panelists Dr. Manvir Bhatia, India's leading neurologist and sleep specialist, and nutrition expert Dr. Deepti, each of whom you will meet shortly. And this webinar is part of our monthly webinar series, our educational contribution to holistic wellness, to quality information, and healthy lifestyle choices. So today's webinar will focus on a very common experience, which most of us consider just as an irritant from time to time. For some of us, it can be so debilitating and bad that we dread it. And for few of us, it can be life-threatening also. So yes, we are talking about headache. So, there are more than 150 types of headaches, and anyone can have a headache, including children, adolescents, and adults. Almost all of us and everyone will experience a headache at least once in their lifetime. Let me invite our panelist for today, our special guest for the evening, Dr. Manvir Bhatia. Dr. Manvir Bhatia is a senior neurologist and sleep specialist with over 30 years in practice. She is the director of Neurology Sleep Center, New Delhi. Dr. Manvir,
Thank you for having me here. And I'd like to, it's a wonderful topic, a very common topic, and I do hope that by the end of this session, we have clarified a few points and, of course, dispelled a few myths about it.
Wonderful. We are so looking forward to it. And the interesting thing, the question is actually to begin with, what exactly is headache? What is it really actually?
So as the word itself tells you, head, when we say head, we mean a part of it, but I think in simple terms, when patients come forward, they talk about all pains, and ache is a pain related to the head, to the face, and almost this whole area, and the back and up till the neck is when they talk about that I have a headache. But they can mean any of these areas, which could be suggestive of what their pains are.
Right. And also sometimes we have a notion that this pain is originating from our brain inside. So is it true?
Yeah, so it's interesting that the brain by itself or by its nature doesn't have any pain stimulated or pain sensitive kind of an area, that if you touch the brain, it's not got a pain receptor. So pain is perceived by these receptors or by certain, let's say, cells in the body or certain fibers in the body, which are like small electrical fibers, which transmit. So we have some nerves which are purely very pain sensitive, and that big nerve is a fifth nerve, which comes over the whole face, which has numerous pain fibers or pain sensitive, and we have some other nerves. Also, the arteries have pain sensitive structure. So the arteries which are in the brain covering the layers are all sensitive. And there are a lot of sinuses which have a lot of pain sensitive fibers. And we have muscles which are at the back of the head, neck, and covering the back, which are pain sensitive.
Wow.
The pain originates from these areas, but kind of radiates or reflects to other parts. And that's why then we start feeling that as if it's coming from inside the head or the brain itself.
Right. So interesting. So actually, it's not inside our brain where the pain occurs. It's the activation of specific nerves, supplying to muscles and blood vessels, and they send the signal to our brain, causing headache. That's so interesting. Okay. So, yes. So as a practicing neurologist, Dr. Manvir, what are the commonest causes of headache you come across? Are there different types of headaches?
So
Like,
in fact, there are about maybe more than 100, 200 types of headache. And like we have, say, a simple example, which we all can understand is something like fever. So fever is just a symptom, but we can have reasons for fever starting from COVID to typhoid, malaria, cancer, tuberculosis. So similarly, when an individual comes forward and says that I have a headache, we need to go a lot deeper to understand this headache. And is it a primary headache or is it a secondary headache? So the secondary headaches are the ones where people are really worried. And most people think that if they have a headache, it has to be something sinister. That do I have a brain tumor? That's the first thought which comes up. But commonest is the primary headache. Now, what are primary headaches are also of different types. Out of them, of course, the commonest one being a migraine. So there is a migraine headache, then there is a tension type headache. Then we have some other vascular headaches with lots of autonomic symptoms. So these are the kind of headaches which are more common. So the commoner ones are, in fact, 80% would be primary headaches and maybe only 15-20% would be secondary headaches.
yes. So that's what it is. The primary ones, headaches, what I understood were without any underlying medical condition. And they are the commonest ones are like tension headaches and migraine, etc. And the other ones, the secondary headaches are the ones which have some kind of underlying medical condition, right? So let's go forward. And perception of pain from person to person varies, as does our pain threshold. So in the absence of standard way to measure the intensity of pain, how do you actually diagnose what kind of headache it is?
So interestingly, that many neurological conditions do not have a very specific biomarker. So what I mean by a biomarker is that, like, if you were to measure somebody's diabetic status, you would measure a blood sugar and say, oh, this is high or low. If you want to measure the blood pressure, it would be high and low. So this is not that easy. But we still, of course, do have certain parameters available so that we can keep a track on the patient and keep a follow-up. And that's basically what we call by history taking or by interacting or having a dialogue with the patient. So to differentiate these categories of pains, firstly, we have certain specific characteristics which have been defined that if you have this, it will be migraine. If you have this, it is tension. Or if you have these features, this is a vascular. So what are these is what I will just say. And in the migraine also, we have separate things. We have acute migraine, episodic migraine, we have chronic migraine, we have migraine with aura, we have migraine without aura. So there's a lot of headache associations, consortiums, which have put this forward. But to say it simply, migraines are usually headaches which come on one side of the head. And this side can vary. So sometimes it can be right, sometimes it can be left. The position can also vary, that it can be in the front, it can also be in the back. Wow. And this back is what gets confused very often with this entity called as cervical pain.
Right.
The front gets very often confused with the entity called as sinus pain.
Right.
So these are the kind of misbeliefs or myths which people have that, no, this is not a migraine, it's my cervical pain, but that the migraine can start from the back. So that's the side and the site. It also has a nature of pain, and that is the throbbing, pulsatile. In Hindi, they say that there's a tuss kind of pain, that you can feel that my artery is throbbing. And then this pain, the other feature is important, is how long does it last for? So it lasts from almost 3 to 4 hours and can last for almost 24, 48 hours or 72 hours. So it's a very long duration pain.
Wow.
And there are other features which start coming along with it. And those are nausea, vomiting, preferring to be in a dark, quiet room. So they have increased sensitivity to light and to sound.
Right.
And any kind of activity makes this headache much worse. So they want to lie down and be quiet. So based on this characteristic of this pain, and then we go forward into the frequency, etc. This is how this pain evolves. And it can start slow, but reach a very high intensity and a peak. And at that time, you are not able to function, you're not able to work, you're not able to do anything. So it causes a lot of a significant disability, as we call it. So that's a migraine. But the tension type headaches are a little different. So the migraines will come for a fixed time and then they are gone. Then they can come again. And we have a lot of things which are called as precipitating factors, that what brings it on. People who've had migraines for long are mostly aware of what brings it on. This could be food related. Things like cheese. In our country, we have rajma, chana, khatta, imli, all that can bring it on. Wine, chocolates, ice cream. Then it's environment related. It's the temperature. These days, I'm seeing a whole lot of people who've got cold related pains. So they said we were perfectly fine. Now it's very severe and they wear a cap, etc. Heat is the same thing. Sunlight is same. Stress is a very big factor. So emotional stress, anxiousness can all produce. So these are the triggers which can make these migraines much worse. The tension headache pain is totally different. It is a pain which is described as if the head is like tight. There's like a band, or there's like a weight on the head, or somebody's pulling my head, and it's a continuous pain. It doesn't have these very marked features that it goes up, it comes down. It just remains. It can remain for months. People are saying it's for years. They'll say continuous pain. It's just not going away. And they don't have so much of nausea, vomiting, light sensitivity, etc. And it's all over the head. So just by the type of pain, nature of pain, accompanying features, we can differentiate. The issue, of course, becomes when people have both.
Right. I was just about to ask you what happens if there is a combination, like having more than one type of headaches, then it must be very confusing.
So it just then again means that we have to spend a lot of time with the patient trying to understand and ask them that if you have headaches for 5 years, if they come to us, we ask, are all the headaches similar or are there different types of headaches?
Right.
And then you treat accordingly.
Wonderful, wonderful. So migraine is so often, it's quite common, I believe, and any kind of severe headache is taken up as migraine, and you so nicely described that what exactly migraine is, and the trigger points and everything. But we would really like to know, how do you treat migraine?
So the migraine treatment actually follows 3 major paths, let's say. Number one is, and this depends upon the frequency of headache.
Right.
And how much is the disability caused to the individual by the headache. So usually by frequency mean how many episodes per month or per week. So if it's 2 episodes per week, that means 6 to 8 in a month, we think it's really frequent. Because by the time one episode is going, the next one is coming on.
Right.
Or somebody may say, I have only 3 in a month, but each episode is lasting for almost 2 days and I cannot work. I mean, it's relating to absenteeism or things like that. Then also we want to treat.
Right.
So the treatment is, like I said, 3 types. One is that you identify the trigger and try as far as possible to handle the trigger. So we cannot do much about the environment or the temperatures, but we can do some things about keeping ourselves warm or cold in that way. Otherwise, is the food, that if you know that this is a trigger, you try and avoid it.
Right.
Third is things like adequate sleep and adequate intervals for food. Long periods of fasting can trigger it. Adequate intake of water and how to handle stress. So
Right.
stress is something that we will all go through. I don't think anybody in this human being in our scenario that we can say that are not faced with it, but how we adapt and how we learn to accommodate. So that's a trigger part. The second is the acute attack. So if I get the episode, what do I do? So in this,
Right.
there are two ways of again approaching this problem. One is definitely we need to take an analgesic, a simple painkiller. Now, what painkiller works for an individual, you can see it could be as simple a medicine as paracetamol to something which could be a combiflam or a etoricoxib or a naproxen, and a combination with something for the nausea, vomiting. So because these people have a problem.
Right.
Now we also have certain specific anti-migraine kind of, not analgesics, but a pill which can stop that migraine. Because migraine, now we understand, has got a cascade of events. It
Right.
keeps releasing chemicals, it keeps making it worse. So this is a new medicine which has come, that if you take that, it kind of stops that cascade.
So it's always better to take it initially when it's starting.
So the common belief in most people is that, let me see, I think it will go away, but it won't go away, it will just get worse. So kill it in the beginning.
Right.
So these tablets, these medicines have come as three forms. They've come as nasal sprays because it's easier and faster absorption. They've also come now as an oral strip, like those, you have these mouth fresheners which come just like you put on your tongue and they dissolve.
Right.
And we had some subcutaneous injections. So they bypass the system of absorption, which is becoming very slow when you have acute migraine. So that is the acute migraine. And then the third aspect is something called as preventive.
Right.
So preventive treatment is the one that I mentioned, that if the frequency is very high, we should give preventive. And we have numerous options for preventive now. In that preventive, we had tablets, which we can start 1, 2, 3, change the doses. And we also have now an injectable preventive, which is again very specific. So it won't allow the headaches to come, or it will change their frequency, severity, etc. So we have a lot of options. So people should not be suffering or allowing the migraines to take over their whole life.
Okay, that's so interesting. So, Dr. Manvir, now this is for us women. Hello, Dr. Bhatia.
Hi,
Dr.
hi.
Dhiraj Bhatia is here with us. So nice
Uh,
to have
Sorry,
you.
there was some glitch. Anyway, we are
We
through.
were really missing you. Yes. Okay, so we're going ahead with Dr. Manvir right now, and we will come back to Dr. Dhiraj Bhatia very soon. So, Dr. Manvir, this is about us women. So some women, suffer migraine during their periods. So it literally becomes a monthly headache for them. So is there any kind of a treatment for this?
Yes, there is an entity called as menstrual migraine, which can happen in two ways. One, that the migraine can come only during the menstrual cycle. So it can come 1 or 2 days before the period and then 2 to 3 days during. So -2 to +3 or whatever. Then there's another variety that you get migraines otherwise, but they just become very severe during the menstrual cycle. So these are believed to be because the estrogen levels just drop and they create this headache or the severity of this headache.
Wow.
How do we diagnose this condition? So it's known that about 15 to 20% of people with migraines can have this kind of an additional problem. So the diagnosis is, again, it has specific things, but people can keep like a calendar or a diary. So for patients with headache, I just want to again add, it's a very good idea to keep something called as a headache diary. So when you meet your physician or your doctor, the headache diaries are a great help. So you note the frequency, the severity, and the duration. So we know how to adjust your medications. So in this diary, they note that every time the menstrual cycle is coming, definitely they have 3 to 4 episodes and the durations are like 48 hours, 72 hours. So for that, we have specific medications. So I was talking about this entity of a specific anti-migraine, which are called as triptans. So these people are given a triptan very early on. And in fact, you can take 2 triptans in a day, morning and evening, for about 48 hours or 72 hours. So don't allow the headaches to come on. So they are a specific form of treatment for this entity.
That's so wonderful. I'm sure many women must be thanking you right now to understand that it's not at all difficult and one can be treated for it. And they should go and get themselves checked and take the medication, right? And we also talked about, Dr. Manvir, about these kinds of headache. Sometimes people have one-sided facial or headaches associated with various other symptoms like watering of eyes, redness of eyes, swelling, and maybe they have even depression or anxiety. So, what kind of headaches are these?
So they resemble something as a migraine headache, because see, when we talked about migraines, we also said they come on one side.
Right.
These entities are sometimes, they're called as hemicranial headaches, and they have something called as autonomic or other vascular features along with it. So migraines are, or people with migraine headaches have sensitivity to light and sound, and maybe mild watering of eye or something. But these people will have a profuse watering of the eyes, profuse watering of the nose. There's redness of the eyelid tends to get swollen, the face will get swollen. They have a marked asymmetry. One side face starts swelling up, and they have this whole feeling that the ear is blocked, and it's a very, very painful condition. But we have about 5, 6 of these, depending upon how long they last for. So some are just for a few seconds to minutes, some are minutes to hours, and some are longer. So each of these, one has to go a little bit more in depth to try and understand. And these have to be evaluated at least once with an imaging. That's a good MRI, because sometimes this could be secondary to something before we say these are primary headaches. But if nothing is there in the imaging, they are primary. And they have a different form of treatment, and they will respond to another type of painkiller, some of them, which is indomethacin. So we have a bunch of these headaches which are called as indomethacin responsive headaches, and they will not respond to any other painkiller. And people are really troubled by this considerably, leading to a lot of depression and anxiety.
Wow. So, yes, the thing is that it has to be diagnosed properly, and the method of having headache diary is very interesting, and I think everybody should keep that so that it's easier for the doctor to diagnose and treat you well, right? Okay. Actually, we find many people, or all of us, when we have any kind of headache, we just, go over the counter and treat ourselves with various analgesics, etc., the simple ones. And so, what do you think? Does such pill popping itself can create some problems for us?
Yeah. So in fact, now in the headache world, we have a diagnosis for this, and that's called as a medication overuse headache. It's called MOH.
Wow.
And it has a fixed, again, diagnostic criteria, but those who are consuming more than 14 days or 15 days of painkillers per month, they will enter into this entity called as chronic headaches and medication overuse headaches. So these people have headaches for more than 15 days in a month. And this continuous consumption of the analgesic starts increasing the likelihood of getting this headache. So more headaches they will get, the more painkillers they will take. And we know what painkillers can do to other parts of the body and besides the headache. So they are continuously in this flux of headache, and it's a vicious cycle. So they say that I take the painkiller because I'm having a headache, but we are saying that you are increasing the chances or likelihood of having a headache because you are consuming the painkiller. So it brings us back to what we were talking in the beginning, that we need to figure out what is the reason for this headache. Is it a migraine which has got bad? Is it a tension headache which we are not able to treat? And then treat them appropriately. But of course, rid the pain, because the pain is a big factor for these people.
Right. So, so much about headaches. So, when do we have to know that the headache that we are having is actually very dangerous? What can we look for, actually?
So we call them something. The word is used as something called a thunderclap headache. So
Sorry,
it's called as a thunderclap headache.
Okay, thunderclap headache.
So the headache which has never been experienced before. It's a very severe, sudden onset pain, which the likes of it you've never had. So it could also happen to a patient who's been having migraines but has this headache. So a new onset headache, which is very, very severe and sudden. It will reach its peak within a few seconds, not like a migraine, which will go slow.
Mm-hmm.
Usually pains in people above 50, 60 years of age should be evaluated. It's not a common feature to get migraines and all at that age. There are, but that's how should be evaluated. Headaches with some other features, a weakness of an arm, difficulty in speaking, continuous vomiting, headaches with some other systemic features like fever, confusion, drowsiness. So these are the features. Or if you examine a person and you feel walking is a problem. So any other either physical symptom, neurological symptom, sudden pains, pains in the elderly, this should be evaluated in more detail with some specific investigations.
And thank you once again so much. And yes, so Dr. Dhiraj Bhatia is there with us, and let me introduce him to everyone. So Dr. Bhatia has been with us for us for all these webinars, and we have been having this a month on month. And so Dr. Bhatia has over actually 35 years of clinical consultancy practice in New Delhi and has been a senior consultant cardiologist with Fortis Escorts Heart Institute and Research Center and Max Super Speciality Delhi. It's such a pleasure to have you.
Thank you, Dr. Anju, for the introduction.
In your cardiology practice, what is the commonest type of headache you come across? We've heard so many kinds of headaches from Dr.
Right.
And what is that is so specific in your practice?
So, Dr. Anju, the most common, which we are seeing in practice, most common cause of headache is hypertensive headache. Now, having said that, one thing should be very clear, that hypertension is a silent killer, because 90% of times they have no symptoms. But when the other 10%, when they do have symptoms, one of the commonest symptoms is a headache. So it can, you can have a lot of other symptoms like a nosebleed, or you could have dizziness or breathlessness or chest congestion or vertigo. But very, very common is a headache. And the headache, the one way to differentiate from migraine is, like, migraine is always unilateral, which means one-sided, and is throbbing. Now, this headache is more generalized. Now, if the blood pressure is very high, the throbbing will come on. Now, it's like a dull ache. And interestingly, it comes early in the morning. So there'll be these early morning headaches, which are very often confused with cervical headaches, because people think, that there's slight neck pain and they've slept in the wrong posture and it's coming in the morning, so it's a cervical. But the message to take home is that you must not, I always believe that saying cervical is a waste paper basket diagnosis. So you should always get your blood pressure checked. Nowadays, every house has an electronic meter. Now there, if you get a reading which is high, I would say it's 100% accurate, but it's fairly accurate. So then, you should go to your physician or a nurse and get your blood pressure seen in both arms, left and right. And if it's high, then you take it up from there. So commonest, I would say, definitely is is hypertensive
Headache
headaches.
due to
As a cardiologist,
hypertension.
I think why a cardiologist, even a general physician would say that. That the commonest
Right.
would be, Dr. Manvir as a neurologist would see a lot more, neuro, like then of course, like she was discussing that they get migraine headaches and, related to menses and
Right.
sometimes
Right.
epilepsy and a whole lot of other things. Yes.
Right. So, Dr. Bhatia, so your patients, they must be on medication for high blood pressure or hypertension. So, do some of these medicines for hypertension also cause headache as a side effect?
Yeah, that's a very good question. So, why it's a very good question is because these poor souls, because of our fault, a doctor's fault, and not being aware of some of these side effects, he starts on medication for high blood pressure, and then you have a new symptom coming up, which is headache, because of the side effect. And very often not realizing it, they don't, put two and two together. And so one big group, there are many, many groups, for blood pressure, like calcium channel blockers, beta blockers, and, ACE inhibitors, many groups, those are technical things. But simple thing is calcium channel blockers, a very common salt called amlodipine. In the old days, it was nifedipine. Now it's graduated to amlodipine. And then you have even further now, this group, calcium channel group, the new medicines come up, but they are notorious for causing headaches. So they're probably the best medicines to give for blood pressure because they really plateau the blood pressure, high blood pressure very well. You don't have the ups and downs, you don't have the troughs. It's a very, very good medicine to give, but I would definitely watch out. I would not like to give it in a person who's, as it is, giving me a history of headaches. So in those cases, I would avoid it. But otherwise, it's a very good medicine to give. And amlodipine, everybody needs to watch out because there are other choices. So that is being a problem. I would say, don't take that medicine. Then there's another group. Yes, another group is your medicines which you give for angina, like sorbitrate. So sorbitrate, that's why it's a good idea to start with a smaller dose and then build it up because sorbitrate can cause a lot of pulsating kind of headache and quality of life goes down. And thirdly, you have a lot of patients taking cough syrup which have opioids in it. And those, like morphine derivatives, those cough syrups are very good to, especially the ones which are good for dry cough. They suppress it. But people are in agony, especially nowadays with the weather and with swine flu and other COVID going on. So you cough, 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 and then you finally say, okay, I need to sleep. So you take more of your codeine-based medicine, and that can also cause headaches. That can really cause severe. You wake up in the morning with a bad headache and you have a really bad day. So these are the three very common ones. So one should watch out for
And
these.
they are so commonly used, doctor, right?
Because
They are so commonly used,
yeah,
right?
across the shelf,
Right,
anybody a child can walk in and thing. And then
right,
unfortunately, there are a lot of students who are abusing them also. So there are a lot of these because they give you a kind of high because they've got a morphine sedative thing in it. So a lot of people get hooked onto it and then they're abusing it, and then they land up with these chronic headaches, and then of course they land up with the neurologist like Dr. Manvir, and it gets very difficult to taper them off. It's almost like a drug addiction. So it's very, very hard, for us to get them off the medicine, and it slows your cognitive function down. Then you land up with, even while driving, with car accidents, So it's actually a red label. Abroad, it will be very clearly written there that don't drive after taking these cough syrups. They can be pretty, pretty dicey. Yeah, I thought I must highlight that. That's very important. Yeah.
That's so very important, really, because cough syrups are anybody is having any amount of it, every day. Yes. So interestingly, Dr. Bhatia, there are some medicines, BP medications that you must be using that also help with the headache specifically.
Yeah.
Are there some?
Yeah. So the first line, when you want to treat somebody for preventive, migraine, of course you have Vasograin and Naxtom and a lot of other things which you pop in when you get a headache. But if you're getting a flurry of migraine attacks in a month, there's a criteria, So then after the number of attacks you're getting and how intense it is, then it's a good idea to give a preventive medicine. And on top of the heap is a beta blocker called propranolol. You could give it long acting. There's Indral and there's Ciplar. You have time release 40 milligrams, you can go up to 80 milligrams. That, of course, should be given not across the counter. It should be, under supervision of a good physician or a neurologist. And that really, it brings the number of attacks down. So quality of life really improves, no doubt. And it's hard for people, even sometimes students get hit very badly and they've got the exams, their boards, and they have these triggers of, coffee and lack of sleep and things like that. So it is a bit of a challenge. Yeah.
Right.
So, but yes, beta blockers, now that's a blood pressure medicine, really. But they found that it has another use, which is like, as you're saying, in migraines, big time use. Yes, that's
so wonderful. So coming back to us ladies again, can Dr. PCOS, polycystic ovarian syndrome, which is so common these days with young girls and young ladies, can PCOS also cause headaches? And if so, then why is that so, right?
So PCOS, really, Dr. Anju, there are two problems. One problem is that there's a hormonal issue where the male hormone kind of starts dominating the androgens. Therefore, you get acne, you get hirsutism, which is excessive facial hair in a woman. Obviously, if your androgens are more dominant, your menses are going to decline. You're going to have less flow and frequency. You're going to have hair loss as well. And finally, male pattern baldness can come in there. That's one aspect of it. So the other aspect is that the insulin resistance is there. The insulin receptors get blocked, so the body responds by releasing more insulin. Now, when the insulin is released in more amounts, it causes weight gain. And that will obviously lead to high blood pressure, especially if there's a family history of high blood pressure. That's one. Now, insulin by itself, besides it's called a lipogenic hormone because it converts carbs into fat. That's one. But also what insulin does is, which most people don't know, it kind of retains sodium in the body. That's why these patients with PCOS say, we have water retention, and doctors say hormonal. But what hormone? It is the insulin. So the insulin is actually what it's doing is causing sodium retention. And whenever there's sodium retention, there'll be water retention. So you're puffed up. Now, obviously, there's a lot of sodium retention. What's going to happen? Blood pressure is going to go up because we know blood pressure, and sodium are heavily linked. So that's the reason. So PCOS, you have insulin resistance and high insulin levels. And with that, sodium retention, and you will have this problem. So there's a very big link between the two. Yeah.
Yeah. So very common. And doctor, even ladies suffering with PCOS, along with having this kind of a problem of headache with sodium retention and water retention, most of them also suffer from tension headaches.
Right.
Yeah.
So very, very common because tension headaches, because of hormonal changes, especially the estrogen changes, will cause a lot of tension headaches. And otherwise also PCOS, I think for a young person is very worrying because everybody reads the net and they know it's the number one cause of infertility. So then, a young lady who just married, she starts worrying that, am I going to have a family? Am I going to have children? Because I've got PCOS. But let me tell you that it's actually very gratifying to doctors. When we find out a person has PCOS, it can be treated well. So it should be like a good cooperation between the doctor and the patient. And if they cooperate with the diet and lose weight, cut down the carbs drastically, because insulin gets, he's the devil in the whole picture. Gets very, very jumpy, very, very jumpy if the carbs are taken in. So suppress your carbs by doing pranayam, by, suppress your insulin by evoking your parasympathetic system, by doing, meditation, pranayam, cutting down your carbs. And then, of course, since I was saying water retention, you should take diuretic diets. So diuretic diets are very, very useful, high potassium diets, like coconut water, coriander, which is dhania, a lot of cabbage, tomatoes. So all these and the many others, which our dietitians will, they can always express themselves better. There's huge difference takes place, when you go on the right track. So PCOS is, like I said, very gratifying. They lose weight, and needless to say, you get a lot of mithai when she gets pregnant. So it's all in all. Yeah, so we do get a lot of dabbas coming in, and because it's like I said, and VLCC in particular is very good at handling PCOS cases.
Correct.
There's no doubt about that. They do very well.
Right. So that's good news for ladies having PCOS because it is totally treatable, and headaches, if ever there are, that can also be managed. Thank you so much, Dr. Bhatia. That was really very, very useful, and thank you for your inputs. And we go to our next panelist. So, diet, exercise, de stressing, and other healthy lifestyle measures have also very significant impact on one's well being. So, let us now understand how diet may also impact it. So, to help us with this, I'm very pleased to introduce our third panelist for today, Dr. Deepti Verma. Dr. Deepti Verma, who has with over 25 years in the field of nutrition and dietetics, currently heads nutrition at VLCC Skill Development. She has been an educationist, a writer, an editor, and has been felicitated with several awards for her contribution to nutrition, including a Lifetime Achievement Award in September 2019. So, welcome, Dr. Deepti, and it's so wonderful to have you with us today. Thank you for joining.
Thank you so much, Dr. Ghei.
Yeah, so it's such an interesting topic today of headache. So as a dietitian, I would really want to know from you, are there some foods that actually relieve headaches and how do they work?
Yes, so actually the intention is not actually to diffuse and tell people that don't take headache medicine so they don't need to suffer. But definitely there is food has a huge and humongous role to play as far as the headaches are concerned. Headaches and migraines, the different kind of headaches that Dr. Manvir spoke about. So first, very important thing that we never realize the importance is the hydration status, because a good supply of oxygen is very, very important, and nutrients which happens through the blood. Because as we all know, blood is the largest connective tissue, and it is blood that supplies oxygen and nutrients to each and every part. And the blood needs to be well, in a liquid form. It has to be flowy, because in people who don't drink enough of fluids, they normally, or who are very high on caffeine. Now, caffeine is something which is extremely dehydrating. Now, because of that, the blood actually starts to get thicker, slightly more viscous. And as a result of that, it becomes very difficult for the blood to take oxygen and nutrients, anti-gravity, that is above the heart, to each and every cell of the brain. So there comes a problem. So yes, hydration becomes very important. And that's why we always advise everyone to take about 3 to 4 liters of fluid, healthy fluid. By this, I don't mean tea and coffee. So anything could be plain water, nimbu pani, very, very good, tender coconut water, or it could be a thin buttermilk and of sorts. So that can be taken. So that's the first very important food. And the second thing is the magnesium-rich food, because in all these years, what I've observed is that magnesium deficiency is something that actually triggers, a lot of headache issues. So magnesium-rich foods, of course, would be lots of fruits and vegetables have got magnesium in them. Peanuts, very rich in magnesium. Bananas, very rich in magnesium. So these are the foods. If we actually take in these foods, we would be getting our supply of magnesium, or else we may need to give in the supplementation to our patients. The third very important thing is to keep the gut health alive. So there's something called Cecobacteria that we also call as gut flora, gut microbiota. So the gut health in today's time is a very, very compromised, affair. And the gut bacteria is actually diminished because of the lifestyle and, of course, the poor eating habits that people have. So our brain is directly connected to our gut through the vagus nerve, and that's where it comes into the picture. So brain and your gut health are very, very closely linked. And always, when the gut health is not that great, it triggers a lot of stress, tension headaches, and other kind of headaches like migraines as well. So taking care of gut health, that is taking lots of pre and probiotic foods. So when we talk about the prebiotic foods, they would be banana, cabbage, citrus fruits, broccoli, the other cruciferous vegetables. And when we talk about the probiotics, of course, they are dairy, in the sense that the curd, which has the lactobacillus bacteria, it is kanji, it is the fermented foods, and multiple others. Or we may need to put the person on a probiotic if need be in extreme cases. So yes, this is so important. And another very important thing is omega-3. So when we talk about omega-3, omega-3 is present in the nuts and seeds. So nuts and seeds are also very rich in magnesium and omega-3. So it becomes a very, you could say that it could be a superfood, for headaches and migraines. So omega-3 actually enhances the oxygen supply, to each and every cell of the brain, and also enhances the nervous transmission. So hence it really helps, and hence omega-3 works that way. So, and of course, like another very important thing that I keep telling this, to go alkaline for a while. If body has inflammation of any kind, it will definitely give rise to pro-inflammatory markers is equal to pain. So in order to avoid that, it becomes very important to, go in for an alkaline diet, which is a vegetarian diet. That is diversity of fruits and vegetables, and different colors of fruits and vegetables. And of course, whole grain cereals, that is with the fiber, and elimination of total processed foods for a while. And with that itself, we are going to see a huge shift in the occurrences of the headaches and migraines. So these are some of the dietary tips that I could give to you for headaches.
Yeah, that's amazing, Dr. Deepti, because it's so good to learn that dietary solutions also exist. Of course, we have to use them along with the medication if required. Dr. Deepti, there are certain foods which also trigger headaches. Dr. Manvir was speaking about them. Would you want to elaborate on that?
Oh, yes, absolutely. First, as I already mentioned in one of the references, there is caffeine, because whenever there is a headache, people resort to having tea and coffee to relieve headache. Now, we don't realize that that's further dehydrating us. And caffeine is one of the biggest triggers of the chronic headaches. So everybody who's on teas and multiple teas and coffees in a day, because they are instant stimulators, but in the longer run, they actually damp us and cause cerebral aches and pains. And that's one. And second is any food which has monosodium glutamate, which is also known as Ajinomoto, which is a taste enhancer, and used in various processed foods, packaged foods, and Chinese foods. And that's again something that triggers cerebral pains. The third food, of course, is like the nitrates and nitrites. So normally we all know that sodium nitrate is a very common preservative, which is used in pickles, pasta sauce, pizza sauce, and lots of other processed foods and curries and gravies that come into the market, say ketchups and stuff. So, of course, like sodium nitrate is again one of a very big trigger if constantly taken. So, like in the younger kids these days who are totally on the foods which are fast foods and junk foods, they normally end up having, cerebral pains in the longer run. And of course, the inflammatory foods, So all the inflammatory foods, that is foods which are very rich in sugar, that is the white sugar, foods that are very rich in salt, and, the other processed foods which are there, of course, they all trigger. So limit the use of the white bread, the cookies, cakes, pastries, anything that has trans fat, chips, etc., because they are all inflammatory foods, and when we consume them, we end up having more of pro-inflammatory markers, which actually results into cerebral pains.
Right. And you forgot about alcohol.
Alcohol, definitely. I mean, like it does. Hangovers and alcohol is pretty like that. That also, of course, yes. That's something that we need to kind of really control. And there is a way to have alcohol. If you really want to enjoy your alcohol, so we don't say stop alcohol. Stop smoking, yes, we do. But we never say stop alcohol, because in some cases, they might even serve us better, like a glass of red wine, which is 120 ml of red wine, would not be that bad. Or just enjoying your scotch or whiskey, in the right way, making small drinks and having it for recreation, not to fill up a void. So in what mental state are we drinking alcohol also makes a difference. But then, yes, it is very important to have healthy snacks with alcohol and to be well hydrated. So between every 2 drinks, we always, like prescribe a glass of plain water or a nimbu pani.
Right.
So, yes.
Yeah. So some of the people actually are, sensitive to the tannin or the flavonoids or the sulfites which are there in wine, which triggers
Allergies,
headache
yeah.
for them. And sometimes it's also the byproducts of alcohol, like acetaldehyde, which which in some people, causes headache. And sometimes it also happens because of the withdrawal. They have been having like caffeine for a long time or alcohol and they stop it. Then there is a headache because of the withdrawal. So yes, all these are interesting facts to know about and be careful. And yes, so thank you so much, Dr. Deepti. This was really wonderful. Thank you for all the inputs. Yeah. So, Dr. Bhatia, are we having any more
Yeah, so
questions?
yeah, sure. There are a couple of questions. One is, of course, very interesting. Again, referring to wines. So, lady is asking that she gets headaches with white wine, and there's hardly any tannate there or tannic acid there. So, why? So, that's usually because white wine is made more from the grape skin. Red is made from the whole grape, and the skin has high quantity of histamine. Now, histamine is some people are histamine sensitive, and histamine
Right.
causes some amount of vasodilatation, and then they get these headaches. So that's the answer. Another question for Dr. Manvir. She's asking a lady that she gets very severe sinus headaches. Any reason, any cause for that? And she's saying, what is the best cure? So cure, of course, it's the usual antibiotics, steam, anti-allergics. But I think cause, Dr. Manvir may highlight something.
So I think I touched upon it briefly. When we call it a sinus headache, we should be very sure that is it really a sinus headache? And we have enough proof and research which shows that very often migraine headaches are being called as sinus headaches. So, but how to differentiate the two? Because migraine headaches also cause a lot of nasal stuffiness. And when you take some Otrivin drops or take some anti-allergics, that nasal stuffiness improves. So people say my sinus headache has improved. But to differentiate this, for a sinus headache, there should be a preceding history of a definite cold, that is a nasal blockage, purulent, yellowish, greenish discharge with some kind of headaches at that time, with fever maybe. So there is a history of a upper respiratory tract infection followed by this headache. And this headache can come in the front, like we said, the migraines can come, it can come on the cheeks. It can also be a very severe kind of a headache, like a bursting headache. Usually will not have features like nausea, vomiting, or preferring a dark, quiet room. So get the differentiation right. And yes, if it's a sinus headache, then this has to be looked at in detail, look at the sinuses, evaluate by either x-rays, meet an ENT, antibiotics and decongestants, etc.
Wonderful. So that answers the question.
So that was by Shukla, who asked this question about sinus. Tantube, she asked, Sachin is saying that is there any link between improper sleep? Because whenever he gets improper sleep, he gets next day he gets headache, especially on the right side. So he wants to know from Dr. Manvir Bhatia that what is the link?
Yeah, a good, very important point, Sachin, that so we didn't have time to touch upon it, but we talked about some triggers. In that I mentioned sleep or lack of sleep is a very big trigger. So this lack of sleep, why it triggers? See, basically we know, there was a very nice article that I read that the migraine or the brain likes a very quiet and a peaceful state. So anything which disrupts it, there is lack of sleep. Is there a lot of snoring at night, which could be with this entity called as sleep apnea? All these will result in changes in the receptor sensitivity and trigger off this cascade of events for migraine. So you're right, lack of sleep is a trigger. And when we talked about treatment, we said one first method of treatment for the migraines is to understand the trigger and to avoid it as far as possible. So a simple remedy would be, please try and get adequate number of hours and good quality sleep.
Dr. Deepti, so for you, Vansh is asking, does headache, Preeti is asking, can saffron reduce headaches?
Well, there has been no confirmed studies regarding it, but then even if saffron is a very, high on anti-inflammatory markers. So of course that way it can help definitely, but alone saffron will not.
And Manvir, Dr. Manvir, they're asking, once is asking, does headache, can it lead to some severe neurological disorder?
So it's a complicated question, and the answer can't be very simple, but there are certain headaches or certain types of headache which can have, a coexisting neurological disorder or can manifest as a neurological disorder. So there is an entity called as hemiplegic migraine, in which the individual can get weakness of one side of the body, almost difficulty in speaking, and will fit the characteristic of a headache. It looks like a stroke. So one has to be but cautious, that be clear that is this a stroke or is it like a headache manifestation? People can also get another type of migraine, which is called as a basilar artery migraine, which can mimic again a stroke in the circulation area of the back of the head. They can get severe spinning, they can have profuse vomiting, they can have double vision, they can have confusion, called consciousness can change, they have difficulty in walking, almost seeming that as if they're going to have a really severe stroke. So there are the question, which if I can understand, that can migraine present like with have neurological problems? Yes. And the other way around is also true, that you can have severe neurological conditions which can present as a headache. So one should be alert.
Right.
So, but the thin line is that we need to be very clear what we are dealing with and how much to investigate and who to investigate. Because over investigation sometimes in patients with with migraines, a lot of people say, please do an MRI, please do an MRI, something is happening in my brain. MRIs are done and you can see some, let's say something called as these white matter spots. Then they get a lot of anxiety over it, that why are these white matter spots? So some of them are specific, some are non-specific. So we need to be very clear not to get too worried about some things which don't have too much meaning yet.
Right. Okay.
But Dr. Manvir, many of them are, sorry, I think the last question, Anju, we are short of time, it's 5 o'clock.
Right.
I think just 1 or 2. A lot of them are writing that is there anything as a gastric headache? And they're really relating these headaches to whenever there's indigestion or gas, they say they come up with a severe headache.
So there is, Dr. Deepti mentioned, but the migraine is actually a very complicated topic. And we have a series. I mean, if you were to draw like a graph, there is something called as a prodrome. That means people feel it coming before the headache itself. And that can be a gaseous discomfort, can be a fullness, can be like fatigue, yawning is one symptom, a lot of restlessness. So they starts like that. Then the pain comes. When the pain comes, they can have this indigestion. They can, sometimes it's like a gastric hurry. They can have nausea, vomiting, and that's the pain part. Then post-pain, that is called post-dromal. They are again very fatigued. They're very tired. They're irritable. They're sleepy. So they think it's like an acute gastric event which has happened. Right. And they all talk about this gaseousness a lot, like this, the gas is coming. I think the whole gut and the whole cycle becomes very sluggish. So the movement and the peristalsis is affected. That's why the tablets that they take sometimes take very long to act. And thus these newer methods of delivery are working a little better.
Yes.
But we need to figure out how much is, what is the frequency, what is the sequence of events, and then we can filter them out and give them appropriate treatment.
Wonderful. I think we've had such wonderful session, and to sum it up, to reiterate, the key to preventing headache is first figuring out what triggers them, and triggers are very specific to each person. What gives one headache may not be a problem for others, and once you determine your triggers, you can avoid or minimize them. And also, like Dr. Manvir said, keep a diary, keep a headache diary, write down what you feel, how you feel, what you're experiencing, and what is triggering and how you feel during that time. So keeping a note of your headaches and how they make you feel can be very helpful when you're talking to your doctor. Thank you really, everyone, for attending our webinar.